Learn English through dialogue. Welcome to the English Dialogue Practice Series. Listen to natural conversations. Practice speaking for everyday fluency and IELTS speaking preparation.
Now, let's talk about health and fitness. I'd like to ask you a few questions about your lifestyle. Do you consider yourself a healthy person?
I'd say I try to stay healthy, but not perfectly. I exercise a few times a week and usually eat balanced meals, but sometimes I give in to junk food or desserts. I also try to get enough sleep, though that can be tough on busy days. Overall, I think I have decent habits, but there's definitely room for improvement.
What do you do to stay fit?
I usually go for jogs in the park or do short home workouts. It's not too intense, but it helps me stay active and clear my mind. I also try to walk instead of taking the bus when I can. Just small habits like that help me stay in shape.
Do you think you have a balanced diet?
Most of the time, yes. I eat fruits, vegetables, and whole grains almost every day, but I do love snacks and sweets. I try not to restrict myself too much because I believe moderation is key. As long as I don't overeat, I think that's fine.
How often do you exercise?
Lately, I've been exercising about once or twice a week. On weekdays, I usually do short workouts at home, and on weekends, I might go hiking with friends. Sometimes I skip a week if I'm busy, but I always try to get back on track afterward.
Do you prefer exercising alone or with others?
I prefer exercising alone because I like going at my own pace. It's sort of my me time where I can listen to music and focus on myself. But when I'm with friends, it's definitely more motivating and fun, so I guess both have their advantages.
Is mental health as important as physical health, in your opinion?
Definitely. I think mental health actually affects everything else. If you're stressed or sad, even your body feels tired. That's why I try to do things like meditation or journaling sometimes. Taking care of your mind is just as important as eating well or exercising.
What do you do when you feel stressed or tired?
Usually, I take a walk, listen to music, or try to get some rest. If I'm really overwhelmed, I talk to a close friend about it. It's amazing how a short break or a good chat can make you feel recharged.
Let's discuss health and wellness in a broader sense. Why do you think some people find it hard to stay healthy?
I think it's mostly about time and motivation. A lot of people work long hours or study late, so they end up eating fast food and skipping exercise. Also, modern lifestyles are very convenient and sedentary. You can order food and shop online without moving much. It takes discipline to make healthy choices in that kind of environment. Sometimes people just need more support and education to understand how simple habits can make a big difference.
How important is physical activity for people's well-being?
It's extremely important. Exercise helps not only with physical fitness but also with mental health. It reduces stress, improves mood, and helps you sleep better. Even small things like walking, stretching, or taking the stairs can have a big impact over time. People often think they need to go to the gym to stay fit, but consistency matters more than intensity.
How has technology changed the way people take care of their health?
Technology has made it easier in many ways. Fitness apps and smartwatches can track steps, heart rate, and even sleep patterns, which helps people stay motivated. There are also online classes and health programs that make exercise more accessible. However, too much screen time can have the opposite effect, leading to a more sedentary lifestyle, so I think balance is key.
What role should governments play in improving public health?
Governments should create environments that make healthy living easier. For instance, building more parks and bike lanes encourages people to be active. They can also run public health campaigns about nutrition and provide affordable healthcare. In many cases, people want to live healthier lives but don't have the resources or facilities to do so. Good policies can close that gap.
How can people improve their mental well-being in today's busy world?
That's a really important question. I think people should make time for rest and activities that genuinely make them happy. Taking breaks from technology, spending time outdoors, or connecting with loved ones can help manage stress. Talking openly about feelings is also vital. Too many people keep things bottled up. Mental health needs to be treated as a part of daily self-care, not something to think about only when there's a problem.
Do you think fitness trends today are helpful or exaggerated?
It's a bit of both, to be honest. Some fitness trends like yoga or home workouts are great because they get people moving. But others are more about looks than health, and they can make people feel pressured to reach unrealistic goals. I think fitness should be about feeling better, not just looking better. Moderation and self-awareness are really important.
How can schools encourage students to live healthier lifestyles?
Schools can start by including more physical activities in the curriculum and teaching about nutrition and mental health. They should make exercise fun instead of competitive so everyone can enjoy it. Offering healthier food in cafeterias also sends a strong message. When kids learn good habits early, they're more likely to continue them as adults.
What do you think are the main challenges in the healthcare system in your country?
I think one of the biggest challenges is accessibility. In many areas, especially rural or remote regions, hospitals and clinics are too far away or don't have enough doctors and qualified staff. Even in cities, waiting times can be really long because public hospitals are overcrowded. Another issue is the cost of private healthcare. It's often too expensive for the average person, which makes things unfair. I also think mental health services are still not given as much attention as they should be. So, while we do have a decent system, there's still a long way to go in making healthcare truly available and affordable for everyone.
Do you think healthcare should be free for everyone?
Well, in theory, I think it's a great idea because everyone deserves access to medical care, no matter their income or background. But in reality, making healthcare completely free for everyone is extremely difficult to maintain. It costs a lot to run hospitals, pay doctors, and buy medical equipment, and someone has to cover those expenses, usually through higher taxes. In countries where healthcare is free, there are often long waiting times, limited options, and overworked medical staff because the demand is so high. I think what really matters is fairness. People should at least have affordable access to basic and emergency care, but for less urgent or specialized treatments, paying a reasonable amount might be necessary to keep the system sustainable. Total of free healthcare sounds ideal, but in practice, it requires strong funding and efficient management to actually work well.
How can governments improve public health services?
There are several ways governments could make public health better. First, they should invest more in training and supporting medical staff, especially nurses and general practitioners who handle most everyday cases. Then, increasing funding for hospitals and digital systems would help improve efficiency and reduce waiting times. Public health campaigns are also really important. For example, teaching people about diet, exercise, and preventive care can reduce long-term costs. I think another key step is making healthcare more community-based, so people can access checkups and advice easily before minor issues turn serious. In the end, prevention is always cheaper and more effective than treatment.